It's September 4th, 2025, and welcome to this month's A&D Medical Live Q&A, where we answer all of your blood pressure and cardiovascular health questions. My name is Abraham. I'm an advanced medical practitioner and pharmacist, as well as the host of the YouTube channel here at A&D Medical, where we create science-backed content focusing on cardiovascular health, everything blood pressure related, and your well-being. So we go live every first Thursday of the month, and I can see the comments still saying everyone can hear us okay. So we go live every first Thursday of the month at 8 AM PST. So make sure to mark it in your calendars and go and grab yourself a cup of tea or anything that you like. Sit back, relax. We're going to dive into some questions now. So just a bit of housekeeping before we begin. All the questions I answer in today's videos have been submitted through viewers, through our comments on our videos, on our social media. So if you ever have any questions related to blood pressure, cardiovascular health, anything like that, drop a comment in our videos, drop a comment in this live video if you can, and I'll do my best to answer it. We have a lot of comments to go through today, so I'm going to do my best to answer everyone's questions, but if we run out of time, I will save your questions and answer it in next month's episode. All right, so without further ado, the comment section says the audio is great now. Thank you very much for everyone for commenting and letting us know. Let's begin with those questions. So first question is from John A74711. So this was a great comment. Does decaf coffee have any caffeine? I don't think a lot of people know this, but the simple answer is yes. Decaf isn't completely caffeine free. So it might surprise a lot of people. The science is basically to be labeled decaf, coffee has to have at least 97% of its caffeine removed, or any beverage basically. So it still leaves a small amount behind. So most decaf coffee, for example, contains about 2 to 15 milligrams of caffeine per cup, compared to normal coffee, which is around 80 to 100 milligrams in the standard cup of regular coffee. So does it matter? For most people, not really, John. So thank you for asking though. But if you are drinking copious amounts of decaf coffee, let's say if you're having 10 cups of decaf coffee every single day because you just love the flavor and you've just got into the routine and you like to have a nice break during work with a nice decaf coffee, then do think to yourself, oh, that could be adding up. If you're having 10 cups, let's say if it's about 15 milligrams a cup, we're talking 150 milligrams there, which is still within the recommended amounts, by the way, but everyone's sensitivity to caffeine is very different. You know, we're all a bit different in terms of how we react to medication and caffeine and stuff like that. So for you in particular, or for someone in particular, that amount of caffeine might actually spike their blood pressure a lot compared to someone else. And remember, I've discussed this many times in our videos on the A&D Medical channel in the past on how to lower your blood pressure naturally. For example, one of the tips we give is to reduce your caffeine intake, because when you have caffeine, if this is a graph basically, and this is your blood pressure, as soon as you have caffeine, the blood pressure spikes, and then it comes back down again, spikes, and then comes back down. It takes about 3 hours for it to come back down. I'm just going to put this on Do Not Disturb, because I did put it on that, but then when we couldn't have the audio, I had to flick it back off. So yeah, it's important just to note that, and hopefully by reducing the caffeine intake, we'll get some improvement in blood pressure as well. So thank you for that comment. I'm just checking the comment section just to make sure everyone can hear me. Okay, perfect. So moving on to our next question from Honey3618. I heard BP medications damage kidneys over time. Is this true? I've heard this question many times in my own clinical practice, in my own blood pressure clinics, basically. A lot of patients seem to ask this. I don't know where this idea has come from, but let's go into the science of kidney damage. So high blood pressure over time, it's dangerous because it damages small blood vessels within your kidney, and this is called a condition called hypertensive nephropathy. All right, so lowering blood pressure actually helps that lower the blood pressure and damage the kidneys, because your kidneys can't handle too much pressure on them. If there's too much pressure going into them, it's going to damage them, and it's going to speed up that progression of damage as well. Okay, in terms of medication specific effects, let's talk about some of the medicines that are commonly prescribed in high blood pressure. So for example, we have ACE inhibitors such as ramipril, such as lisinopril. These are the generic names of the medication, by the way. And we have ARBs, for example, such as losartan, candesartan. I don't know any of the brand names, by the way. So if anyone's watching and they know all the brand names, then just find out these generic names. but they actually have a protective effect on the kidney. So these medications, so like ACE inhibitors and ARB, actually protect the kidneys, all right? They lower your blood pressure, but they have a protective effect on the kidney, especially in those with diabetes or early kidney disease. So one thing about them, though, that I think might stem these thoughts that, oh, I think these medicines might damage your kidneys, is when your medical provider starts you on an ACE inhibitor or an ARB, they will request bloods, okay? So they'll usually have baseline bloods before you start on them. And then when you get started on them 2 to 3 weeks later, that's the usual guidelines, they will do a repeat blood test just to make sure that your kidney function is remaining stable and your creatinine hasn't gone up. Creatinine is a waste product, basically, that your kidney removes. And sometimes it can go slightly up when you first start these medicines, but it does come back down. But it doesn't damage your kidneys. So that's the most important thing you need to remember. There are other treatments as well. For example, diuretics like thiazides, you might have heard of. They can affect your electrolyte levels. And that's why we check your bloods again when you start on these medicines. That's to check things like your potassium, your sodium, just to avoid long-term issues. In terms of what does damage your kidneys long-term, Honey3618 for this fantastic comment, uncontrolled high blood pressure, major contributor. So if you have uncontrolled high blood pressure and it's consistently above 130/80 millimeters of mercury, when you're checking your blood pressure, then it is going to speed up kidney damage. Another one, very common one, overuse of painkillers, okay, analgesia, like NSAIDs. So NSAIDs include things like ibuprofen, naproxen, you might have heard of them. If you're using them consistently, they can damage your kidneys quite significantly. So definitely do speak to your medical provider if you are someone that's consistently taking these medicines, as well as not, monitoring your kidney function during treatment. So if you're getting any treatment and your medical provider is inviting you in for your blood test, your routine blood tests, always get those done. So don't put them off. So bottom line is treating high blood pressure slows down kidney damage. And the key is regular checkups, blood tests, and sticking to your treatment plan. So I really hope that was helpful. Okay, thank you. The comment section is very live today. Thank you, guys. I'm really enjoying this. I always enjoy doing the live Q&As here at A&D Medical, our YouTube channel. So thank you very much. I'm just checking if there's any questions on here. The first ones are all about the audio problems that we had. Cephalon and Ventrix, really interesting. I'm a new subscriber. I love the content. How often do you release videos? We release video. Well, thank you for being a subscriber, and it's great to have you as part of the A&D Medical channel. We release a new video once every 2 weeks. So a long video goes once every 2 weeks, and we also release short videos, YouTube short videos, twice a week. All right, so that's done all year round. So if you're subscribed, you're going to get a notification. On top of that, the cherry on top, as we like to say, is our live Q&As as well, which happen once a month. Like I said at the start, first Thursday of the month, 8 AM PST. Lewis Bean, I did not know that. Thanks, Dr. Abraham. Thank you very much. Thanks for the comments. Okay, awesome. So we're going to continue. I'll keep flicking back because I have my comments on one screen here. So if you have left a comment, don't worry, I will come back to you. Next comment is from Peter Paperwork. I love that username, by the way. Can losing 5 kilograms actually lower blood pressure? The easy answer is yes. Losing any amount of weight will lower your blood pressure, okay? The key here is if you are overweight, reducing your weight will have a bigger impact on your blood pressure than if you are, in a normal weight category. Losing weight will lower your blood pressure, but probably not as much as if you are in a more obese category or overweight category. Okay, so that's the main thing you need to remember. In terms of research, for every 1 kilogram, that's about 2.2 pounds, by the way. For every 2.2 pounds that you lose, you're going to drop your blood pressure by about 1 millimeter of mercury. All right, so you can expect that. So it might not sound like that much, but if you think, like in the comment, a 5 kilogram drop in weight, so that's about 11 pounds. So if you lose that much weight, we're talking a 5-point drop in terms of your blood pressure. So if you're borderline with higher blood pressure around, high blood pressure, for example, if you're 134/84 and you get a 5 millimeter of mercury reduction, you're suddenly going to be in a much healthier, safer range, which is going to lower your risk of strokes and heart attacks, kidney disease, all of the things that we know that high blood pressure is associated with. And as we always say, high blood pressure is a silent killer. It's generally symptomless. You don't really feel any different, but it's causing all of that damage internally and increasing your risk of all these cardiovascular events. So in terms of how does it also lower your blood pressure, because I always have patients asking this, when we lose weight, so weight loss is going to help reduce insulin resistance, it's going to reduce inflammation, reduce the strain on the heart and the blood vessels, and it's going to improve how your body regulates salt and fluid, which directly affects the blood pressure. So you don't have to lose a huge amount to see the benefits, but even a small amount of weight loss can make a big difference. So I hope that was helpful. All right. Do you recommend, so we've got another comment here. Thank you for your comment, Megan. Do you recommend wrist or upper arm monitors to your patients? I think it really just depends on the patient. It depends which one is easier for them to use. Wrist monitors are a lot easier to use in terms of a lot quicker compared to, for example, an oral blood pressure monitor, which are very easy to use as well, but they're obviously a bit larger. Wrist ones are a lot smaller and easier to carry around. Our A&D Medical blood pressure monitors are all on the validated device listing, so they are clinically tested, so you know they're accurate. That's the most important thing. So always making sure that the blood pressure monitors that you are using are clinically validated for accuracy and on the VDL list, because believe me, we talk about it a lot in our videos, but a lot of blood pressure monitors that you can buy on Amazon or various other retail websites are not on the VDL list, so you're not sure if they are accurate. And that is the most important thing when it comes to blood pressure monitoring. So it really is a case-by-case basis, and it just depends which one is going to work better for you and your lifestyle. So I hope that helps, Megan. Thank you for your comment. Moving on to the next comment. Again, please do keep leaving the comments. I'm going to keep coming back and forth, so don't worry. If it takes me a couple of minutes to respond to you, I will get back to you. All right. So next comment is from Daniel Furlin 5714, and this was quite recently actually. When's the best time to take blood pressure and pulse? I'm 75, active, walk, jog daily. My readings average around 114/77 in the morning, 99/70 in the morning, 117/77 in the evening, 103/70 in the evening. Pulse sometimes 58 to 65s in the morning. Do AM versus PM matter? I love this comment, Daniel. Thank you very much for the comment. First of all, I just want to say they are very good readings. So that's really, really good. And it's clear, you know, you're staying active. Like you said, you're walking, you're jogging daily, and you're monitoring yourself. So thank you for joining us on the channel and leaving that comment. They're all below 120/80, which is ideal for most adults. In terms of best time, I always recommend checking in the morning before food, coffee, exercise, and any medication. So that's your AM readings. You should always try and stick to the same time. And again, in the evening as well. There are normal variations for blood pressure, and that follows your circadian rhythm. So it's usually your blood pressure is lower during sleep, and therefore when you wake up, you'll get lower readings. And I can actually see that with your readings, Daniel. So your morning readings are lower than your evening readings. So, and then towards the afternoon and evening, our blood pressure will go up and it'll be slightly higher. Lower morning pulse as well is commonly seen in fit people because your pulse is excellent. Regular exercise also makes the heart more efficient. So it needs fewer beats basically to do its job more as efficient basically. Just flicking back onto the comments. But the key message is both morning and evening readings matter, but consistency with timing and tracking long-term trends is the most important thing. And I always talk about our A&D Heart Track app. If you don't have that already, go and download it. What are you waiting for? It's a free app. It's on the App Store. You can find the link to it on all of our videos on our YouTube channel as well. It will be in the description of this live as well at the end when it's updated. But it's free of charge. You can put all your blood pressure readings on it, your pulse, that kind of stuff. Or if you have an A&D medical monitor, blood pressure monitor, like the precision check device in my hand right now, this is Bluetooth enabled, and many of our devices are Bluetooth enabled. It can sync with the app and basically transfer your information and your blood pressure readings onto the app. So it's all synced on there, automatically goes on there. And if it's not a Bluetooth device, don't worry, you can add them manually. So it's as easy as that. Perfect. We are doing great. We're just going on to the next comment from JCP. Thank you for your comment. How tight should I put the blood pressure cuff on? This is a very common question that I get asked, and we get asked as well on the channel. So if you are not wearing your blood pressure cuff correctly, it can throw off your readings by about 5 to 10 millimeters of mercury. So it can give you an incorrect reading. The rule is simple. The cuff should be snug, but not painful. And I always say the 2-finger rule in all of our A&D medical videos. The 2-finger rule is very simple. So I'm just going to take this out of the blood pressure monitors to show you. So when you put your blood pressure cuff on, you want it to be 2 fingers above your elbow. So the bottom of the blood pressure cuff should be 2 fingers above the elbow. And also you want to wrap it on, tight enough, basically, so you can just about fit 2 fingers into underneath. All right. If you can fit more than that, it's not tight enough. And if you can't fit 2 fingers under there, just about, then obviously it's too tight. So that's a really good indicator for how tight you should have it on. If it's too loose, your readings will be falsely low. Excuse me. And if it's too tight, your readings might spike and cause discomfort. So we've actually done experiments on our channel, on the A&D Medical channel, showing you what happens if your blood pressure cuff is too small, if your blood pressure cuff is too big, if the placement isn't right, and it's really interesting. So if you haven't watched those videos already, please do go on the channel and watch those videos where we show these experiments and we show the difference between doing it right and doing it incorrectly, and just how much of a difference it can make in your blood pressure readings. So easy as that. One other thing as well, just to mention, many of our A&D Medical blood pressure monitors, like the precision check device in my hand right here, they have features on them which our team of global engineers at A&D Medical, and this is one of the reasons why I love the A&D Medical devices so much, because we have a team of global engineers who are consistently reviewing and studying our devices, making sure they're accurate, and also adding new features on our newer devices as well. Many of our A&D Medical devices actually have advanced cuff fit detection. They have advanced movement detection. So if the device notices that the cuff fit isn't correct, if there's a problem with it, you're going to see a symbol come up, which kind of reminds you like, hey, something's going on here. This isn't right, and it could affect your reading. So again, the blood pressure cuff is kind of giving you that safety net as well. And that's one of the things that I love. Okay, back onto the comment section. I've just come back on. Hadia Hussaini, thanks everyone for all the information. I feel like ever since watching this channel, I've got a better hold on my blood pressure than I did before. That's so sweet. Thank you so much for that. And I'm really glad that you're finding the channel helpful. We put a lot of effort in our videos, and our channel is getting thousands and thousands of views every single day on YouTube for those who are interested in blood pressure, those who are interested in cardiovascular health, and are wanting to learn different things, from learning how to use their blood pressure monitor to learning natural ways to lower their blood pressure. And it makes me really happy to read these kind of comments that you're finding the information helpful. So thank you. Just going back onto the comments now. So this comment is from Cami Go Live. Thank you for your comment. Does arm position really matter when taking a reading? Yes, arm position totally matters. And again, we showed this in our experiment that we did, showing what happens if you don't take your blood pressure correctly, if you're making mistakes, what happens. And one of them was actually doing a test with your arm not supported, so not supported on the table, as in just hanging loose, compared to it being supported. So in terms of correct position, when you're taking your blood pressure, always remember, sit on a chair with your back supported. So have a chair with a back support like this, feet flat on the floor, very important. And rest your arm on the table. I don't think you can see my table, but rest your arm on the table. Make sure you haven't put your cuff on and then just hanging it down and taking your blood pressure reading, because it's going to give you an incorrect reading. If your arm is too low, basically like you're just hanging it down, gravity is going to increase the pressure in the arteries. So it's going to give you a falsely high reading. And if it's too high, for example, if your arm's up here, it's going to do the opposite. It's going to give you a false low reading. So it's really important. And again, the features that we have on our A&D Medical blood pressure monitors, like I said, on some of them, we have the advanced cuff fit detection, advanced movement detection. So they're really good features as well that we've got there, just to help give us that added safety net. Just going back on the comment section to check up if we're doing all right. Yeah, we're up to date with all the comments, so thank you very much. So going back onto my comment sheet. So next comment is from HM Magnuson. Thank you for your comment. How much ground coffee is 1,000 milligrams of coffee? 10 cups of double espresso is different than 10 cups of lungo. Medical measurements don't translate well into real life. I completely agree with that, by the way. It's always difficult to translate medical measurements into real life and see what you're doing exactly. And it's something I get asked a lot by my own patients. How do you actually apply these milligrams and units into real life? So let's break it down into a simple way that makes sense in daily life, so you can just keep things simple within healthy limits. All right. So the recommended daily caffeine limit is 400 milligrams for a healthy adult. All right. So that's just the recommended healthy limit. So don't go any more than that. If you have high blood pressure, ideally you should be trying to keep your caffeine milligrams basically a bit lower. So 200, 300 milligrams max, but if you can keep it lower, even better. I appreciate a lot of people like to have a coffee, including myself. So how much can you have, And then you need to really think, well, the typical drinks, an espresso shot, a single one, has about 60 to 80 milligrams of caffeine. Instant coffee, one heaped teaspoon, has about 70 to 90 milligrams of caffeine. Filter or brewed coffee, like a mug of that, has about 90 to 120 milligrams. And then we move on to other drinks, like energy drinks, for example. A normal can, not a big can, just a normal can has around 80 milligrams of caffeine. Black tea has around 40 to 50 milligrams in a normal mug of tea. Green tea, a normal mug, has about 25 to 35 milligrams. And another one, I remembered, decaf coffee. Okay, we spoke about that right at the start, actually, because we already had a comment a bit about caffeine. Decaf coffee has about 2 to 15 milligrams of coffee, so it's never zero. So important to remember. So how to apply this? You've just got to try and count how many caffeinated drinks you're having daily and just multiply it by the rough caffeine amount. It's not an exact science. You're making a rough estimate, just a scientific estimate, really. But if you're getting close to 300 milligrams, I'd say, or anything up to that region, consider switching one or two drinks to a decaf alternative or even a herbal tea. So a simple rule of thumb that I always like to say is, if you're having more than 3 mugs of strong coffee or 2 energy drinks per day, it's likely pushing you over the limit, especially if you have high blood pressure. So if that is you, try and cut down or replace it with the herbal teas and the decaffeinated version. So you don't need to count every milligram, but just have that simple rule of thumb in your mind, and then you can just see what you're drinking and calculate it. I think we all have an average amount that we know we drink during the day. I know, for example, I have 2 cups of coffee a day. That's just my normal average amount. Some days I might have 3 cups if I meet up with a friend or something like that. But on average, if I'm in the office just working, I'm going to have 2 cups, no more than that. I don't usually go more than that. So everyone can think back and just think to themselves, how much are they having? And then you can also see if it's making a difference. And that's where the A&D Heart Track app really comes into play, I think, because if you're then making adjustments and lowering your caffeine consumption, then you can actually see how much of effect it's actually having when you're taking your blood pressure reading. And if it's actually lowering your blood pressure, or if you're having too much coffee and you're actually seeing an increase in your blood pressure. So tracking data for me is really important and really helpful. Okay. Right, so it looks like we have come towards the end of this live show. I've gone on for a long time. It's a 27-minute episode, so it's a lot longer than usual. Cephalar and Ventrix, I've just seen your comment. Can blood pressure affect your energy through the day? We've run out of time in this month's episode. I apologize, but I have noted this down right now, and we will answer it in next month's episode. So please stay tuned for that. I'm just taking a screenshot of it so that I can refer to it again. Once again, thanks to everyone for tuning in, and thanks to all of the followers and subscribers for actually letting me know that the audio wasn't working at the start. Again, remember, we make videos every 2 weeks, and we have a long video on the A&D Medical channel all about blood pressure, using your blood pressure monitor, making lifestyle changes, all this sort of stuff. So definitely go and watch them, and go and watch our experiments, because I absolutely love our experiment videos. And actually, just a bit of a teaser, the next video we've got going live is a really cool video, and where we experiment looking at smart rings and smart watches and actually seeing how accurate they are when you're comparing them to, a real blood pressure monitor, the A&D Medical blood pressure monitors that are clinically validated on a validated device listing, and just to see, are they accurate or they're not accurate? So I'm not going to give you the answer to it, because I really want you guys to watch it. So definitely watch that out when it goes live, because I loved making that video and doing the experiment. Thanks everyone for watching, and I will see you in next month's live Q&A, first Thursday of the month, 8 AM PST. As we always say at the end of every single A&D Medical video, A&D Medical, discover precision. Have a great day.